Thanks. Dr. Ingrid Tall is my name, and I'm here with Maria, who wants to be de-identified naturally, so that explains the unusual mask on her face. Today we're going to talk about platelet rich plasma, otherwise known as the vampire facial, or to some as regen. Now, platelet rich plasma is a treatment where we actually harvest the platelets from a person's blood by a simple blood test, and we spin it down in a centrifuge here on site, and the blood component is left behind, and we use the straw-coloured plasma. Now, this is very rich in platelets, and these are rich in collagen stimulating factors and growth factors. So it's this that actually improves the texture and tone of the skin. That is often used then for treatments around the eyes, for the fine lines around the eyes, just in the face in general, and also in lines, for lines in the neck. So it improves the thickness of the skin by boosting and stimulating the collagen growth. So Maria had a simple blood test just taken, and then we spun it down in the centrifuge, and this is an example of the plasma, which is what we're going to infuse into her skin. Now, traditionally we have used needles, however in the neck we've recently started using the cannula, which is a blunt, non-needle. You still need a needle to get the cannula in, but then it's blunt tipped, not sharp, and it pushes the blood vessels and nerves out of the way. So there's less pain, less swelling, and less bruising. If I could ask you, Maria, how did you find it when you had the procedure?
Not painful, a bit uncomfortable, but it's not painful at all. I feel okay.
Thank you, Maria. Now, Maria has had 3 treatments in the past. This is her 4th one. She only started 6 months ago. It does take 3 months from the previous treatment to begin to see the benefits of platelet-rich plasma. So her neck is a work in progress, and if we got her back in a year, it would be considerably improved than what it is even now. But 6 months down the track, you can see quite considerable improvement already in her neck. So what I'm going to do now is put a little bit of ice on here, and also then she holds, funnily enough, this is the world's biggest vibrating instrument, and she puts that just onto her collarbone here while we're doing it, and that really improves the sensation as well. So we're just going to start with a little, here we go, big breath in, Maria, a little entry site for the cannula, and she feels a little bit of pulling and tugging, and the ice has made that a little more comfortable. And then we start infusing the product through that entry site. So she feels a bit of pulling and tugging. That's very good, Maria. Well done. So a lot better than if, there we go. There's the first little bit. Excellent. How are you feeling, Maria?
I'm okay.
Very good, love. Very good. And then we just work our way through those lines and infusing the plasma. Can you pop your chin up for me, please, Maria? Well done. Takes us about 5 minutes or so to do the whole neck, not very long. And we'll come back after we've finished, and we'll show you the end result. Well done, Maria. Going well on. Thank you, darling. Thank you so much for doing this, Maria. So I've just completed the infusion of Maria's plasma into her neck. How did you find that, Maria?
No pain at all. It was good.
Oh, that's
very
great.
comfortable, yeah.
That's excellent. Yeah. And having a look here at Maria's neck, you can see the 2 little entry sites. There's a little bit of swelling here where the plasma has been injected. We can give that a nice gentle massage and soften that out. And within 10 minutes, Maria can be back circulating in the Queen Street Mall here in Brisbane, and no one will know. So that's pretty exciting. Advances in technology. So we look forward to seeing you here in the clinic having some platelet-rich plasma in your own neck. See you then. Bye-bye.